Hey, good morning. This is Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. We are delighted to be back with you this morning. It is a wonderful, beautiful Tuesday morning, and we are honored today to have U.S. Kansas Representative Sharice Davids in the studio today. Representative Dave, thank you for being here today. We're so delighted to have you. And we have another honorable guy. I hate to even say that. Man, do I have to say it to be so nice to him? KDHE Secretary Dr. Lee Norman, a very good friend of mine, and my predecessor, Chief Medical Officer here at the Health System. We are always delighted to have back with Lee Norman. And just to say to you both, thank you all for your service to our area, to our state, to our country. It has been nothing short of phenomenal, and we are delighted. And we know you guys both had to take a lot of bullets or arrows in the last few months and even a year through this pandemic. And as I tell our team around here, you get enough arrows in your back, they become your shield. So eventually, you're protected.
I'm feeling better already.
Yeah,
I gotta come back here more often.
There you go. So the Dr. Dana Hawkinson, our Medical Director of Infection Prevention Control, is still close by. He is right here with us in the studio today. He is appropriately distanced per the CDC guidelines for hospitals, and we have all been fully vaccinated. We wear our masks, but we take them off when we're here in the studio because we do have a negative airflow room. And also, with the new guidance from the CDC, since we're all vaccinated, that makes it a little safer to do that. We're meeting all the guidelines. Hey, this morning, we're going to first jump to our numbers, and then we have another special guest we want to introduce. But first, Hawkeye, how do we do?
Well, you know, your guest today really making you look good. That's a good thing.
Well,
And your right-hand man today is much more distinguished and respected and accomplished than me.
Yeah,
so
he's a little
good.
grayer, though. He's a little grayer.
Yeah, quick rundown of the numbers. You know, Hays has 1 in recovery only. We here at the health system have 5 active infections with 1 in the ICU, none on the ventilator. Just as you mentioned yesterday, our last patient that was on the ventilator was May 24th. So we're doing good. So 5 active infections and 6 additional in that recovery period, so 11 total.
Man, we're staying down. I like it.
Yeah.
The ripple effect from the opening and things coming back in, we're not feeling a bad ripple so far yet, Hawkeye.
Vaccinations. That's what's helped to drive all that down.
I think it makes all the difference. We're going to be talking a little bit more about that. And, you know, this studio is so cool. The brand new studio, we flipped it. We've beamed these guys right into the studio. This is awesome. We should try and do this more often. It's like a cool Star Trek moment.
I agree.
All right. All right. So we have
It's
another.
faster, too.
And it is faster, yeah. Yep. We have another special guest who's somehow looking at things. I'm not sure what he's doing, but his name is Dr. Paul Camerata. Paul is also a good friend. Paul is our chair on neurosurgery. He's an outstanding surgeon. We are delighted to have him with us today. He's going to show you something very colorful and very special. We wanted you first to see what a 3D model of the spike protein on the SARS-CoV-2 looks like. You know, we spent all this time talking about the spike protein. Well, this is the 3D model of what it does look like. Our chair of neurosurgery, Dr. Paul Camerata, had this model created to help teach about the spike protein and maybe a little bit about vaccination. It also is a good test for our new printer. So, Dr. Camerata, the spike protein is kind of complicated. What kind of printer can do this kind of work?
Well, it's a pretty amazing printer, Steve. This is a Stratasys J750 that we put in. We got as a department. Actually, at the beginning of COVID, we had purchased the machine. It couldn't come in for the last year and a half because of the workers that had to remain at home. So we finally got it up and running. And one of our first requests was to print this as an educational material. This is the actual spike protein. The viral membrane sits here. And this is, you know, on the little model, you see all the little blue spikes all over the sphere. That's what this is.
That is just amazing. And I said to someone, when you and I were talking for the price, I said it kind of looks like coral reef or something. I mean, it's so complicated.
It's amazing. The printer actually prints in over 500,000 colors, many different substances, many different structures and consistencies. And we got it basically because as neurosurgeons, we're trying to teach both people and our residents, and so we can print up a brain, we can print the blood vessels in the brain. Dr. Norman knows a few years ago we had a previous generation printer we used to print up aneurysms inside the head, and we would sort of simulate the surgery for our residents, so we think it makes for better clinical care of patients having something like that.
That is really cool. Can you print a better memory circuit in my brain?
Sure, we could, and then we can put it in.
Yes, I knew you could do that. You are so amazing. Yeah. Okay, so this is pretty cool because I take it you're going to use this to your patients and talk about getting vaccinated.
Exactly. Now we can show this to them. This actual model took 22 hours to print. So,
Oh,
so
my.
that you saw the sort of the schematic of the printer running, and it prints. It's kind of like a DeskJet printer. It lays the ink down, layer at a time, sub-millimeter layers, and then you have to wash out all the kind of supporting material that holds it up. It's a pretty sophisticated process.
That is really cool. So how many of these can you make? Because can I have one in my clinic?
Sure. So Jason Gorup, who's our clinical research director, is in charge of that. I've got to clear it with him first.
Yeah. I saw him. He looks like a pretty good dude there. He's doing a lot of work around this.
Yeah, he and his team spent the last couple of days making sure this thing turned out right.
So it's pretty fascinating that a neurosurgeon gets a cool new toy. That's a cool new toy.
Yes,
And,
we have a lot of those.
Yeah, I know you do. And then one of the first things you produce is a spike protein. Thank you for doing that.
Oh, you're welcome. No, it's our pleasure. It's not brain surgery. Had to get that in once.
Yes, you did.
Right.
So Hawkeye, where is that? Where when we vaccinate? How does that? How do talk to us about what this spike protein's doing around vaccination and? Because I think some part of this is the part that pries open your cell and causes all the trouble. How does a vaccine work to make
so
that?
just as Dr. Camerata mentioned, it's attached to the viral surface on the bottom part there where that red is, just like that. Basically, that is 3 different of the same protein called a trimer, and they form to make that spike, and that's why you see 3 different areas there, especially if you're looking.
1, 2, 3.
Right, so those combine together, and then that is what is on the top there and on the outside, especially that blue area, is what we call the receptor binding domain, or the RBD. That's where we do see where it interacts with the ACE2 receptor on our bodies to attach to our cells and then gain entry into our cells.
And when you get a vaccination, how does it neutralize that whole thing?
So all of those little areas on the spike protein, there are quite a few of them. They are basically chopped up in our cells and presented to our immune cells, and then our body makes antibodies to those. So even those little areas in blue where it binds to our receptors, those are the important neutralizing antibodies. So our body makes specific antibodies to very specific areas on that spike protein.
So those blue areas that are attaching in and causing all the havoc and opening up the cell. And so when we get a vaccination, we're making antibodies against that blue area to cover it up so it can't get in. Is
Correct.
that the plan?
Those will help, but there are also other areas on the spike protein not associated with that receptor binding domain that are conserved, so they don't change, because we know that there has been changes, and that's where we see the variance. But there are areas that do not change at all. Those are more conserved regions, and those help give us epitopes or things that our T cells can react to as well. And so that's why it is both antibody or B cell immunity, but also T cell immunity that helps to keep us well and clear the virus.
I'm glad he's here because I could never have done that. What do you think?
Amazing.
Yeah, it's pretty
I could have
impressive.
stepped in if you
All right. So you just want to live long and prosper.
That's
V
right.
for vaccination. All right, folks.
Hey, Dr.
That's about it.
Stites.
Thank you
Dr.
very
Stites,
much.
Before you go.
Wait.
Gene-
Hey,
yeah.
Paul, hang on for just a second. I think I'm hearing something from Jill.
Yeah, Gene is one of our viewers, and he doesn't understand why that doesn't look like all the pictures we see. Could you explain again where that part of the model attaches on the virus?
You bet. I think it's better if we just throw this. Can I just pitch that over to Hawk? I wouldn't do that.
Be careful, he'll have you
Did you get the
3D
question?
print an enterprise for
Yeah, I will. Where is my Star Trek? Huh?
He didn't get the question, so.
So the question
Oh, yeah.
is, can you talk a little bit more about, or you guys talk, where it is that the thing that the antibodies work to attach to this blue section by covering up? Talking a little bit more about how the antibodies protect us by preventing these areas of the virus from prying open our
And then
cell.
when
He
you're
just
doing
says
that,
it doesn't look like the model
Yeah.
that we see all the time.
Yeah, it doesn't
we
look
see
like that
these
model.
like
So basically what you're
That's
looking at is a representation of the amino acids. And the amino acids form when they are put together during the making of the spike protein and of other proteins. They will eventually take forms and shapes, and that's what that is. That's why it's not just one large globule or one large mass of plastic. Basically what that is trying to mirror the shape that when those amino acids really get together at the molecular level, what those are causing. And they have things like beta-pleated sheets. And these are just terms that have been designated for for quite some time during research of the amino acids. So basically what you're looking at is what the actual structure looks like based on the amino acids when they get together and when they form.
And just to say, I think what we're seeing, if you see the picture on our screen, a lot of times it's got the little red spiky proteins. The problem is those red spiky proteins aren't really drawn to scale and to the same degree of specificity as this is. This is just a much better, much more accurate representation than what's up there on your screen.
And you have to remember, in those you have electrons and different, it's just really more representative of what it actually looks like on the molecular level.
Okay, Spock, we're getting pretty specific. We're going to talk about what do you add?
Oh, well, I was just gonna say, is that
That
when
little
we
red
look
things.
at those little tiny, all the little tiny red things,
Yep.
that's like a piece of one of those little red things?
That's this. Well, this is the red thing. It's just
This
that
is the
red
red
thing is just not as well.
Oh, I
that's-
see.
That's more of an artistic representation. This is actual more of a scientific
Oh.
representation.
And can I touch that?
Well, heck
Have you
yeah,
been immunized?
there you go. It's
It
kind of
got me.
cool,
Wow.
and it's amazing that a printer can make all that.
It is, yeah.
Yeah.
What are
it's
these
very
little
specific.
dots? Is these little tiny, there's like,
Those are
Little-
connections between the proteins that make them fold and then stay like that.
oh, okay. Wow.
Science is
Science.
cool.
Science is
Science
cool.
is
Exactly.
cool.
I'm gonna come take some classes.
All right. Paul, thank you for
Thank
coming
you.
aboard.
Thank you very
Thanks
much
for all your
for-
great
you
work,
bet.
buddy.
Thank
See you, Paul.
Great neurosurgeon. You ever need to see one?
Thanks,
See Paul
Paul.
Camerata. All right, so we wanted to also now turn to Representative Davids, as well as to Lee Norman after that. First,
All right. Thank you,
Dr.
guys.
Davids. Good Lord, I got it all confused. Sharice, how has COVID-19 impacted the people you serve, and how are they doing?
Oh my goodness. Well, I think you guys probably know that in a lot more intimate way than I do. The pandemic has had such a devastating impact on literally all of us. Like everybody's life has changed in one way or another, and I think from health and well-being to and then the fear and anxiety around that. I think we've seen a lot of impacts on mental and emotional health as well, because this has been so traumatic. And then, lots of folks lost their jobs. Lots of folks had to keep going into work, even though they weren't sure. But I also have noticed a lot of, now that more vaccines are getting out there and that people are starting to be able to hug their family members again, that things are starting to feel a little more like normal. The sun's coming through the clouds here.
What are you most proud of the work that you were able to do on the behalf of Kansans? What are you most proud of the things that you and your office were able to contribute?
I think that when I look back over this, it's been a little bit longer than a year now. Being able to pass and start implementing the COVID relief or coronavirus relief packages. There were multiple iterations of those, and so I think that by federal standards, being able to really listen and adjust along the way, it felt really good to be able to do that and to still figure out ways to connect with people, because so many of us to stay physically healthy had to physically distance, but we were still able to stay in touch with a lot of the folks in the district.
Connection, disconnection, connection's a whole lot more fun, isn't it?
Yeah.
Oh my gosh, it's such a difference. What worries you the most, do you think?
I would say, of course, making sure that as many people as possible can get vaccinated. I want to make sure that the resources continue to be there for vaccinations, for testing, for personal protective equipment, and then just making sure that our economy is able to get back up and going, and growing the jobs that we've seen lost during this time. And I think that it's interesting because it's both a worry and a reason for optimism.
Mm-hmm.
I think we're really starting to pick up steam here. I was gonna try to, we're heading toward warp speed. I don't know.
Yeah, I like that.
I know
like
you
that.
liked
Yeah,
it.
it's good. We're both Trekkies, so this is going to be fun, right? You're more of a next-gen person, I sense already.
Oh yeah,
Yeah,
that's
yeah.
right.
So,
And Discovery.
And Discovery is the best.
Yeah.
Have you been vaccinated?
I have been vaccinated. I've gotten both. I had one of the 2-dose vaccinations, and it didn't it's interesting because full disclosure, I am one of those people that people think that because I did mixed martial arts that I'm this
Super
real
tough.
nothing hurts, or I'm not scared of anything is probably more accurate what people think. But I actually was looking forward to being able to get vaccinated, and then encouraged my mom to get vaccinated as soon as possible. And so my hope is that it's 12 and up now. I hope that everybody who's able to get to a vaccine center or through their doctor gets vaccinated.
Yeah, boy, I hope you're right. That would be the best, right? So, Dr. Orman, what are your thoughts about that whole general pandemic trend line and how we're doing on vaccinations in Kansas?
First things first, the trend line is doing really quite well, but we have to remember we still have about 100 or slightly more new cases every day.
Yeah.
We still have 1 to 3 deaths every day, and put that in perspective. And the deaths are preventable. If we had 1 to 3 deaths per day from something else that was preventable, that there'd be rioting in the streets. Mm-hmm. So the fact is the numbers have come down quite dramatically, but we still have a ways to go. But it is encouraging, and without question, as per Dr. Hawkinson, I agree, it is vaccine related. That's what's really saving us. A couple changes are coming I think it's important to talk about. One is our legislature has decided to allow our state emergency declaration to expire on the 15th. So that means we'll be gradually standing down our emergency operations center. I do not want people to come away with the idea that means that because the emergency declaration for the state of Kansas is going away, that somehow magically the virus is going away. We still have the same battle. We still have the same need for vaccinations. Vaccinations have dropped off dramatically. We did 2 million in the first 20 weeks, so 100,000 a week. We're down to about 40% of that. Where we used to want to do 1,000 or 2,000 vaccinations a day, now at the same kind of settings, we'll do 100 to 200 maybe. Good news is schools are picking it up with 12 years and older. We've had one school district that had 600 kids in one day.
That's awesome.
And now that same group of them have come back for their second vaccine. So that's a real promising. There's even kids that are dragging their parents in that haven't been vaccinated to show them the right thing to do, and then they get vaccinated too. So on the up and up, I think we're doing pretty well, but we still have a lot of things to be cautious about.
Well, we do. And how closely are you watching the reports out of Lynn and Livingston counties in Missouri where wastewater tests showed the India variant, or the Delta variant as we now say?
Yeah, the new nomenclature using alpha, beta, gamma, et cetera. We are seeing the same thing on the Kansas side, both in wastewater, and we have seen that same variant on the Kansas side as well. It's not the predominant variant of concern at this point, but we're watching it carefully. Exciting, as excited as I've always been about wastewater testing.
Yes,
that's
you love wastewater testing.
Yeah.
I'm just going to say.
It worked.
It's kind of cool.
We were experimenting with it, and it really has been helpful.
Yeah.
We're doing the same thing. We just started last week with sampling air. We have 10 devices. We're doing pilot studies to see, and imagine coming back in the fall with certain classrooms to find out. In a way, it's like saliva testing, except you don't have to even touch anybody. It's just air testing.
And you just kind of measure the parts per million and see if it's going up.
It's basically presence or absence of it. It's PCR testing, so it's very specific. And whether it'll fit in or not in the work settings or in classrooms, I think it will. We'll find out. It's not a new technology, and I'm sure that you know this. Sharice, out in D.C., there's air sampling that goes on looking for anthrax and all those other nasty things of people that might want to do somebody harm. This is the same technology applied, obviously, to COVID-19.
And so, Lee, as you look at the future here, what do you think is going to happen with vaccination in Kansas, and how can that help protect us against things like the Delta or whatever the next variant is going to be?
Yeah, and Dana can address, I think, better how efficacious the vaccines are against the different strains, but they all work against these various strains. Some work better than others. I think we're going to see a booster at some point in time. We don't have the the formulation yet or what the schedule will be or when it will appear, but I think indicators are that there'll be a booster recommended. And then the other thing, I just heard this yesterday, as a matter of fact, that one of the manufacturers is looking at single-dose syringes to, as mundane as it may sound, multi-dose vials, and especially they have to be refrigerated in a very delicate manner, are a whole heck of a lot more difficult for small medical practices and the like. And if we could get single-dose vials or single-dose syringes preloaded, that would help just to make it easier. Because one of the things we found is that a lot of people still that aren't even necessarily reluctant or hesitant to get the vaccine, it has to be really easy and almost come to them. But we'll do whatever it takes to get into the vaccines into folks.
What percentage of Kansans 12 and over have been vaccinated now?
We're over 50% now that have been fully vaccinated.
That's awesome.
Yeah, and we're getting right at 60% that have received their first vaccine. The big chunk in the numbers in Kansas, obviously, are those that are 12 and under.
Yes.
And that's I think right around 400 or 420,000 people. So it's important, to your point. Will we get to 70% by July 4th like the president? No, we won't. We'll probably be just a little bit less than that. And Dana and I have talked forever on herd immunity, whatever that, if there's a number and let's say we pluck 75%, that's still months out.
Yeah.
It could be as far as 7 months.
We'd
So
love
we
to
need
have
to
it done soon,
accelerate
but-
the pace.
Yep,
We need to
you bet.
accelerate the pace.
All right, so Jill, let's see if there were any reporter questions out there this morning. Reporter questions. Are there any reporter questions? I'm not hearing any.
Good morning, guys. It's Taylor at 41. I have a
There
couple
he
questions.
is. Awesome. Hey, Taylor.
I was like, they must be worried about me. I have questions for both your guests this morning, if that's okay.
You bet.
And I'll ask them both at the same time, and then you guys can choose how you'd like to do them. For Dr. Norman, we're already seeing, and we were reporting on this morning, different tactics that different schools are doing as far as rules they're putting in place for masks and non-masks for summer school, that kind of thing. Can we expect to see a uniform requirement or any kind of rule for the state whenever school starts in the fall? I know you guys did schools a lot yesterday, but I wasn't on the call. Just what we can expect from a statewide perspective on schools in the fall when likely the younger students will not have been vaccinated yet. And for Congresswoman Davids, Congresswoman, I want to ask you about federal unemployment benefits. We've talked so much about people that are trying to hire people right now and are not able to, and those federal unemployment benefits continuing to be different for some states, and Kansas one of those. Just your take on what those should be and what Kansas should be doing as far as unemployment right now.
All right, let's start with Dr. Norman, Lee Norman.
Yeah, the masks in children is very controversial, and I probably hear more complaints against the mask in children, and also the other side of it is parents saying it's so critically important to protect our kids. And we do provide statewide guidance, but as you likely know in Kansas, the local jurisdictions and the local school boards have the ultimate say in that. But our guidance will remain that unvaccinated persons should wear masks. And so we'll still have the same recommendations for distancing and mask wearing until which time we can vaccinate children. But there will be a lot of pressure, and I think we'll end up with an odd patchwork quilt throughout the state of Kansas. But unvaccinated people should wear masks to protect themselves from getting ill. 80% of kids haven't caught the illness, and none of them have been vaccinated, those under 12. So mask wearing will be advised.
So just a quick follow-up on that, but does the end of the federal or the state emergency declaration going to impact the ability to have different mandates around masking?
No, it doesn't change it a bit. We will still have our ability to propagate guidance, as do the local health departments.
Okay. Congresswoman Davids. So here we go. Federal unemployment benefits, are they keeping people at home?
I think so. Maybe you'll appreciate that the data doesn't play that out, actually. And I think that some of what ends up happening during this time is folks are looking for answers. People want answers to why we're feeling the types of impacts that we're feeling from the pandemic. And so, of course, I'm a big proponent of looking at the data. Right now, the unemployment relief that we've provided for folks has really I mean, it's been a lifeline for so many people. The folks who've reached out to our office about it, I know that a lot of the people who are reaching out to us, they want to get back to work and are running into various barriers, whether it's access to childcare, schools, making sure that early childhood centers, some of the businesses, small businesses that we've lost, unfortunately, have been childcare related. And then there's also the the fact that some folks are still, whether they're hesitant around the vaccine or just are not sure what the safe thing to do is, are still concerned about going back to work. And so I think that there's a lot of different factors that are playing into the difficulty that we're seeing for folks to be able to find to find employees, and then also the difficulty folks are running into trying to get back to work. Because I know tons of folks, they want to get back to work. People are, I think, excited to see other humans, not that they don't love their families, but excited to see other humans in real life. And so my hope is that over time, we'll start to see, as the economy starts picking back up and more people get vaccinated, we'll start to see more folks filling those positions that are open.
Yeah, I think the pandemic caused such an unraveling of life as we know it that to try and put it back together again isn't simply a light off-on switch. And it's a very complicated. I think you did a great job for that, because it is multi-layered, right? People, is the child care company open again? What are your work requirements going to be like? What's transportation like? I mean, there are just so many things that for so many people on a daily basis are challenges, and you have to put that whole picture back together. It is hard to do, I think. You can't just turn the light switch back on and off. Yeah. It's hard. I wish it was as easy as taking off your mask, but it's not quite that easy.
I know. Or putting them on.
Or
I
putting
actually
them
think
on.
it's super cute. The little kid masks are really, they get the coolest looking
No,
masks.
I don't know. I got a couple of cool Star Trek Discovery masks.
Do you?
So I'm
Yeah.
just going to say I'm cool when I wear them. At least I think I'm. I don't
Some
know
Elmo
anybody
ones
else.
out there.
Hawkeye, this whole question about vaccination and getting people safe and what else can we do you think, to get the message out? Vaccines are the way we get safe.
Yeah, I think individually, again, I said, I had a patient even on Friday that didn't want it because that patient didn't believe coronavirus was real, thought it was a government hoax. So individually, that patient felt, I don't need to get it. Even if I get it, it's nothing worse than a bad flu. But, I was just talking with Lee earlier today. There was a CDC press release yesterday which continues to support the ability of the vaccination to help prevent transmission to other people. So it continues to be an act of charity to help people around you. Okay, you may feel you may not get sick, even though you're probably over 60, over 70, and you're at high risk of getting sick and severe illness. You may not believe it, but you have to understand, too, that you do pose a risk to other people. So we have new data supporting that it does help probably reduce transmission because you're not replicating as much. You aren't replicating as long. So it's an act of charity to other people around you and to your community to help get vaccination so that you can help stop the spread. And it's just continuing to provide that message in one way or another so that people continue to understand. And it will be an uphill battle because we obviously know the people that demanded the vaccines early on have gotten them. And now we really are working on those people who are vaccine hesitant.
Yeah, such a big deal. Well, Jill, I bet there are a few questions out there from our listeners and our viewers.
There are this morning, and I think that Dr. Hawkinson may have really kind of spoken to this, but Pamela, who wrote yesterday and she wrote again today, wants to know, and this time Dr. Norman, she said, you said people that are unvaccinated need to wear the mask to keep from getting the virus, yet in the past we've said the mask keeps me or the wearer from getting sick. Can we clarify, what does the vaccine do? What do the masks do?
You bet. And I think it's very clear, actually, that masks both protect you from getting the virus, and clearly they protect you from giving the virus. So really, it's better in this situation because you're going to protect both directions.
Ditto. I couldn't have said it better. Agree with that. And, I think that one of the things that Dr. Hawkins and I were talking about today is early on in this pandemic, we recognized we didn't know everything. We were far from that about COVID-19.
Building the airplane as we fly
Right.
it.
But we both felt comfortable that we knew everything there was to know. And now the body of literature is expanding, exploding, and we're learning more all the time. Masks protect both the wearer and the people around the wearer.
It's so important.
Can I-
And go ahead, Sharice.
Oh,
because
no, I
wanna
was
ask
just
you about the politicization of the mask. I still don't understand that.
Oh, I don't understand that either. I guess I just want to make sure because I'm the least educated person in the room, I think. But it did take me 8 years to get my undergrad, so maybe a number of years. So it sounds like the mask, not just, it helps me not get sick, but it also helps other people not get sick. And then when you were saying earlier that the vaccine, that also helps me not get sick, but then even if I get the virus inside of me, then I'm like my body isn't creating whatever it is that like goes out into the world and can get other people sick for as long.
Pick that up.
Yeah, certainly, again, starting at square one, we've always said from day one, the masks provide a barrier. Now, as we got further into this, we also understood that even cloth masks, not just surgical masks, can protect the wearer as well. So it is a barrier, so you're not expressing the virus into the community, but it also does provide protection for you, even those cloth masks. Moving on to that, the vaccination, we are learning now from real-world experience. Of course, we are really look to Israel because they have had such a good vaccine uptake and have done it early, so they have a lot of good information. And now there's just more information coming out saying that when you do have the vaccine and you have that immunity, it helps reduce the amount of viral replication that your body is doing. So then you are not replicating as much. You are then, therefore, less likely to express more of that into the environment, or other people then can get infected.
Here's a follow-up question about vaccination, too, and this is one that could get us in schools, especially colleges, because we have a lot of students who come from overseas. They may be getting a vaccine, say the AstraZeneca one, that's not been, has not received an early use authorization in the United States. Should they get another vaccine that's a U.S. vaccine, or at least like Moderna, Pfizer, J&J? And if so, what would your recommendation be about that? What do you think?
Well, you don't even have to come from overseas to have this question, because we know that people have gotten vaccinated someplace else in this country and they don't have their shot record, and we don't know if they had the Pfizer or the Moderna. We do know that they were told at that time that they needed to have a second vaccine. We have no specific guidance on this yet, but I think where we're going to wind up, and I'm looking at Dana to see if he agrees with me, is I think that ultimately, and there's some tests going on about mix and match, to have one of one kind and the second one of a different kind, I think will probably not only be acceptable, but might possibly even be preferred. But I think one of these days in the not too distant future, there'll come guidance down that will probably allow that. I don't have a crystal ball that tells me that that's what I just said is exactly true, but I kind of hope it is, because I want to have a second vaccine.
I'm going to go where you are, especially for the Sinopharm vaccine, because its effectiveness is the one from China. It's not that great, and the Russian one nobody really knows about. So I'd say go get another vaccine, Hawk. What do you think?
Yeah, I think if you have not received one of the 3 emergency use authorized vaccines here in the United States, I would say go ahead and get a dose of either Pfizer or Moderna, one of the mRNA vaccines.
Yeah, that's what I would say too. That would be a recommendation, but we don't know that the CDC
Based
is
on
going to say.
just-
Yeah, just based upon our
I
medical
have
knowledge.
no comment.
All right, Jill.
Mary wants to know what resources will go away from the COVID vaccination and contact tracing effort with the expiration of the emergency order.
Right. Well, we're sorting that out right now. We'll be presenting to the governor the transition plan. The contact tracing and case investigations will go on without any diminution in the ability to do that. Where the Emergency Operations Center really helps us is with some things that are kind of behind the scenes, like warehousing. We have truck drivers. It will take away our National Guard troops, Air and Army, unfortunately. But we will backfill that with contract nurses. So it should go on unabated, and I think that we will be able to keep up with the demand for vaccine and for testing, for that matter. So that should be relatively unseen by the public.
And so a follow-up question to that, I think, is that going to affect your ability to do the testing of wastewater and things like that? We talk a lot about.
Right. Fortunately, as per Congresswoman Davids and the federal monies that have come to us for vaccinating and testing, that comes to us regardless of the state emergency declaration. So we'll be continuing with the testing.
And does that affect telehealth?
A little bit different question that comes in through in our situation, in my agency, is the only one I can speak to, is through the Medicaid program. When eventually the Medicaid reimbursements will decrease a little bit, that could have some adverse effects. We're trying to keep telehealth alive, very much alive and well.
Please keep that up. And so, Congresswoman Davids, so tell us, have you been involved in any of the telehealth efforts outside? Because for those of us who practice this, I'm putting in my own 2 cents now. I'm going to do a little lobbying here at the studio. Gosh, telehealth has made such a difference for us.
Yeah. And actually, so 2 things I want to bring up. I'm so glad we're talking about the importance of wastewater. I mean, I just think that all of us should be, especially policymakers, but kind of generally, it's really helpful for people to understand the importance of wastewater as part of our, not just infrastructure, but public health.
Yes.
Clean drinking water is something I think comes to mind a lot quicker for folks,
Yep.
but wastewater is definitely really important. And then, so I'm glad it's come up a couple of times already. And then when it comes to telehealth, I think we're at this. This makes me think of earlier when I was saying, none of us wanted a pandemic. People have just been devastated by this thing, but we have the opportunity right now to learn from what's been going on for the last year and a half. And telehealth is one of those places where we have seen increased access, particularly for some of our rural communities. We've seen increased access for folks who are unable to leave their home for one reason or another, transportation issues and that sort of thing. And so my hope and goal and some of the policy that I've been working on is that we can take the things that are really helpful from that and make sure that we continue some of those practices. And I mean, the reimbursement rates are really important, making sure that that our hospitals, our physicians and providers are able to continue to offer those services. And then the other piece is broadband is so important, and I think there's the evolution of what we think of as infrastructure is happening in broadband. I mean, in my lifetime, I'm pretty young. We've seen the recognition that broadband is obviously part of our connection, just as much as roads and bridges are. Our ability to stay connected through broadband access is really important, and that impacts our rural communities. And I mean, right up the street, there are folks who either because of broadband in the ground or technology, we gotta bump up the access for that stuff.
Yeah, and it's going to get better too. That whole 5G thing. I live right next to or close to a 5G tower for Sprint or T-Mobile, whatever they're called now. That stuff flies. I mean, that's impressive. It really does make a difference. You don't have to put a bunch of wires in the ground all the time. So I think that's exciting. Jill, what other questions do we have?
Isaac has a couple. He wants to know from Dr. Norman, at the end of the emergency declaration, will that impact vaccine distribution going forward?
No, it'll just impact who does the delivery. Instead of our State Emergency Operations Center doing some of that, we'll have FedEx and UPS. So we'll just click over into some new contractual arrangements. Shouldn't affect that at all.
And his follow-up question is, how many people received a first dose more than a month ago but never got the second dose?
What percentage of patients are failing to get their second dose?
Oh, I got you. It's it's less than 10% that are not getting their second dose.
But it's interesting that the data, Hawk, on the Pfizer Moderna looks pretty effective after one dose, but you want to get that second dose to not only give you the full effectiveness, but to help you have longer lasting immunity. Both things are important.
Yeah, that durability. Getting that second dose is going to help cement that specialized immune response. So it's very important. We know that you do have some partial immunity after that first dose, but really to gain the most benefit, it's really getting that second dose.
And a lot of people don't get it at the third or fourth week, but eventually will get it. And we encourage them, of course, no matter when it is, to get their second dose. So
Right.
some people just aren't timely.
And in Great Britain, in fact, you're often waiting 3 or 4 months or
Yeah.
longer to get the second
Right.
dose because they try to get so many people to have the
Yeah.
first dose, which they think has made things a little better. Not clear, though, with the Delta variant that that's going to work out as well because it looks like that second dose really helps protect against the Delta variant.
Yeah, I mean, again, I think it all goes to get that second dose, even if it's delayed, it's going to still offer you that full protection, getting that antibody immunity, getting that T-cell immunity.
Makes a difference. Okay, Jill.
All right, Angela wants to know, her relatives are delaying getting the vaccine because they said they heard recent news reports that make them think that if I already had COVID, I'm really protected and maybe even longer than the vaccine.
Oh, I don't know about that, Jill.
No.
Let's talk to Hawkeye and see what he thinks.
No, we would say that is inaccurate. A lot of what we're looking at for these types of things is just looking at antibodies. But we also do understand that looking at those studies, that even if you've had it and you get a dose of the vaccine, those antibody levels are going to be higher than just natural infection. We also do understand that if you had mild disease, very few symptoms or no symptoms at all, your immunity probably is not as good as what you can get from the vaccination. So that's the main talking point there is you are probably going to have better immunity, longer lasting immunity with the vaccination.
All right, Jill. Time for one more question, I think.
All right, Emily
Maybe
is
two.
Okay,
We'll go with
2. No,
Okay.
we'll go for 2. Yay!
I made you happy.
Okay,
See,
maybe-
how about that?
You know me so well.
I
Okay.
know. Keep Jill happy.
I'm on the viewer side. That's all it is. Yeah. Emily wants to know, she's worried that the vaccine is an experimental substance that we're putting into our body and it is not an act of charity. What would you say to Emily?
Oh, it is definitely not an experimental substance. In fact, mRNA vaccines have been around for really over a decade now.
Yeah, they've been around a long time. And with I don't know, Dana, if you know how many hundreds of millions of doses given around. I mean, it's one of the most tested and one of the most experienced products in modern history. So this is the fact that it doesn't have full FDA approval, and they will. The fact that they don't doesn't necessarily mean it's experimental. I think that's conjures up something that's maybe not intended, but I think it is used occasionally to dissuade people. But this is really not an experiment. It's a very well-established vaccine.
And vaccination technology has been around for generations and generations, so we know.
Yeah.
And Hawkeye, we've seen, I think we've heard that there may have been 1 billion doses given across the world and overall, and we're just not seeing terrible side effects from really any of the vaccines that are in use here in the U.S.
Yeah, I think that number's up to 1.7 billion doses now is kind of the last number I have seen. You also have to remember that, so that is much more than any of the vaccines we're giving here, like shingles vaccine or tetanus vaccine, things of that nature. Also, as you said, the platform, the technology is not new. Also, especially if we're talking about the mRNA vaccines, there's only 9 or 10 components in that vaccine itself, no preservatives, and those components are present in other vaccines as well. So continuing to believe that it's experimental, it's just not keeping up with the actual data, the science, the safety record. We know that these are very safe and effective. It's not an experimental thing anymore. It is well proven now with multiple data collections and reports about the safety and efficacy of that.
All right, last question.
Yes, it comes from Fanny, and it's kind of I have a question for the medical team, and then she has something that she wanted the Congresswoman to know. Fanny says that I am back to work at a nursing rehab where some of my colleagues won't vaccinate. Isn't that vulnerable to the patients? Some are in their 90s, even 100s. And then that's her question. She wants to know, are they at risk? And then the second part, she just wanted the Congresswoman to know that Medicare never approved tele-rehab for occupational, physical, and speech therapy, so most of us nationwide were forced to apply for unemployment or face getting COVID in the settings where we work.
Man.
Just
All
FYI.
right.
Yeah, thank you. Can you write into our office?
Did
Did you say it was Fanny?
Fanny is her name.
Oh,
Fanny,
okay.
if you can.
Okay, thank you.
And it has to be difficult because you guys have so many folks you have to represent and so many key issues. That had to be a real challenge because there are almost competing issues sometimes within the pandemic. How am I going to help one group? How am I going to help another group? How did you decide to do that?
It's interesting because there are often times where it might feel like that they would be competing interests, but especially when it came to the pandemic, whether we were talking about people who were in need of care, people who were providers, people who were employers, people who were employees, the vast majority of people who were reaching out to our office were trying to figure out ways to be helpful. What do I need to do to keep folks on the payroll? And then, I think that when it comes to the occupational and speech therapy and those areas, I'm really curious to hear from. I hope Fanny is able to write in to the office because I want to make sure that we're not leaving folks behind or leaving folks out of programs, especially that were clearly designed to be helpful for folks who are dealing with those issues.
Yeah, that's a great point. Okay, so then let's take on the second part of that question. What was the first? Say that again, Jill.
Okay, I had to turn my mic back
So
on.
she works at
She
a-
works in an
Oh, the
area
nurse
where
says
they're
that.
not
Thank you.
they're not vaccinated.
Right.
See, you're still really bright from all that school. I need more of those little. I need some more of that.
Johnson County Community
That kind of special
Scenic road.
printer thing that's going to 3D printer. Give me a little more brain cell.
I do feel very strongly that people that work in nursing facilities should be vaccinated. And I'm basing this not on an emotional response, but the fact that we see a lot of outbreaks in nursing facilities and we do case investigation, contact tracing, and it's from a 40-year-old unvaccinated worker who comes in and infects the residents. The good news is that most residents, over 90% of them, are vaccinated, and a lot of the infections that we've picked up in those folks, they are completely asymptomatic. And these are even people that are in their 90s, for example. So it's dramatically successful, but I think it's a moral obligation when working with in those kind of settings to be vaccinated.
And I think, individually for that person working in the facility, we saw that a lot of those essential workers were living in some of the hardest hit areas, whether it's because of multi-generational housing or what that may be, living with a lot of other people, doing things like that. And so we want to continue to protect them as well.
Yeah. All right, folks. Hey, tomorrow the Kansas Leadership Center is back to talk about a conversation they're trying to have with 750,000 Kansans who are on the fence on whether to get vaccinated. Ed O'Malley, the president and CEO, is joined by Juliet McBride, project leads for the Kansas Beats the Virus campaign. Learn how you can get involved if you want the help. Learn about that tomorrow. We'll be here. Final thoughts from today. Dr. Norman, let's start with you.
Two things. One is on Saturday, it was our 500th day in Incident Command. Incident Command is 24/7, 365 battle rhythm, and I want to thank my team and our lab, all the county health officials that have been struggling through this as well. So 503 days later, we're still at it. The second thing, Ed O'Malley tomorrow, where this came from, and if he doesn't tell you that, I want to tell you today. I gave a talk in Wichita, and I said, what we need is ground troops. We need foot soldiers to go out and community by community, and they took their graduates from the Kansas Leadership Center, and Ed, the light bulb went off above his head as we were having this conversation, and that's where it came from. It was just a very simple, we need ground troops. Where do we get them?
I like it. Hawkeye, final thoughts for today.
Yeah, I think it all goes back to vaccination again with the new press release, with the accumulating amount of real world and benchtop data about the need and the positives of vaccination. It continues to look like, number one, if you get vaccination, you're going to be protected from those things that we want you to be protected from, hospitalization, severe disease, and death. But you are also going to protect other people by reducing the amount of virus that you're replicating, the chance that you're going to infect somebody else. And so we're continuing to see that the vaccinations are safe and very effective, and we'll continue to give that message.
Dr. Norman Davids, final thoughts today.
First of all, I am so glad that you all do this every day and help folks understand some of the science behind not just the vaccines, but the pandemic as a whole. And then I'd love to come back and talk to you more.
I think you've got an open invitation, so I think we would love to have you back.
And just, I'm sure people are, I think I'm often a broken record here, but I'm so looking forward to all of us getting back to like seeing each other in person, and the more of us that get vaccinated, the more hugs we can all have.
Hugs are the best.
And so hugs and cookouts and, getting out to the games and So I just would encourage everybody 12 and up to get their vaccines, and let's get back to in real life.
Boy, isn't that the best? Hey, you know what? Vaccination is our path out of this pandemic, and we need you to help us do all the things we can to get the vaccine hesitant and vaccine procrastinators to take action. Just this past Friday and Saturday, the Speedway joined in the incentives to get a shot and or get tested. People who did either earned the opportunity to drive their personal vehicle on the track for 2 laps behind a pace car. Hope they didn't go too fast. I'd be a little frightened about that.
Wait a minute.
They also qualified for door prizes. The track event lured 40 folks to get shots on Friday and 126 Saturday for a total of 166 more people vaccinated, and there were 240 tests given over those 2 days as well. Thank you so much for doing that. If you need your first or second dose of the vaccine, call us here at the Health System at 913-588-1227 and make an appointment. You can also go to kansashealthsystem.com/vaccine or schedule through MyChart. This is the way out of the pandemic, folks. The other day we said disconnection, connection. And yes, that's the theme of Star Trek Season 3 and Discovery. But the simple story is this. We've said all along in this program, there's no place like home. And that's still true. But there are other places that are great too. You want to feel safe when you go? Follow the V for vaccination. That keeps you safe. It keeps your loved ones safe. It keeps us safe as a society. And most of all, it is safe. We'll see you tomorrow.